Hi, I'm Chris James. I'm a hand surgeon at the One Hospital, and I'm going to be talking to you today about Dupuytren's disease. Well, Dupuytren's disease is a funny sounding term, and it generally reflects the name given to a disease which affects the palmar fascia, or the tissues within the palm and the fingers. It's extremely common, and in fact affects males more than females, and tends to be hereditary in its nature, i.e. it's in the genes. And this is why it is sometimes known as Viking disease, because it tends to stem from the more Scandinavian ancestors. Well, it presents generally with thickening or nodules within the palm of the hand, and sometimes in the fingers. The ring finger is the most common finger which is affected. And as this progresses with time, it forms cords which extend down the line of the fingers, which are often visible. And as these cords thicken, they contract the finger over, thus pulling the finger and preventing extension of the finger. And this can be very functionally disabling for patients who present with this disease. It can affect both hands, single hands, and also can affect the feet at times. Some people get this in a very mild way, and the nodules and the cords do not progress. We often leave these alone. Other people get this in a more radical fashion, and the fingers, all the fingers can be affected, and it can progress rapidly, causing severe functional issues within the hand. Well, in the early stages of the disease, stretching, massaging to the cords and nodules within the palm can help with comfort and sometimes pain that's associated in the early stages of the disease. Stretching exercises to try and maintain the extension of the fingers can be useful, and we have hand therapy specialists in this hospital who can aid patients with this. Sometimes we use splints for nighttime wear, because during the sleeping hours, hands tend to curl over such that they are more bent in the mornings than the evenings, and this can be often beneficial for patients with the disease. Well, it's very important to realise that surgery is only to treat the symptoms of the disease and not the disease itself, which is incurable because it is largely of genetic basis. There are some smaller operations that can be done in the early phases of the disease, and there are two options. There's an injection with a substance called collagenase, which injects along the line of the cords and dissolves the diseased tissue. Or another smaller operation can be done under local anaesthetic with a needle which breaks down the tissue. And both of these have similar results and usually allow for extension of the fingers. They're largely when the disease is affecting the palm and rather than the digits themselves. With more severe disease, there's a very routine operation which is called a fasciectomy, which involves some zigzag incisions along the line of the palm, and the skin is opened up and the whole segment of the diseased tissue can be cut away, and then the skin closed, and this usually will improve the symptoms markedly. So I'm more than happy to provide opinions and to speak to any patients with regards to their hand or contractures, as there are often other causes of contractures as well. Please see your GP if you have any concerns at all, and they can refer you into the One Hospital here.